Did you sign off the order from the NHS CEO to discharge elderly patients from hospital back into care homes without testing them in March 2020?
Well, in March 2020, we didn't have the tests that we needed. We didn't have a testing regime. That's one of the lessons of the pandemic. We didn't have a testing regime at any scale. But what we
At what time do you say you didn't have enough tests?
Well, at that time, I mean...
Because between the 17th of March and the 15th of April, about 25,000 people were discharged from hospitals into facilities. That's according to the National Audit Office. And by that point, you already had capacity for 10,000 daily tests. And there were over 530,000 tests carried out in the UK by the 20th of April. So there was a testing capacity available. You chose not to use it on people being discharged into the care homes.
Well, it had to be clinically prioritised. And to clinically prioritise...
No, but you just said the tests weren't available. Well, so I'm just making the point that they were available.
No, what I said was enough tests weren't available. Important difference, right? Because then once you have a certain amount of tests, and we started with, 100 tests a day, and then we got up, you're right, to 10,000 tests a day. I think it was by the end of... by the start of April, and then I set that 100,000 tests a day target to make sure we had a lot.
Yes,
right.
I know, but this was the key moment.
Yeah,
this was the key moment early on when you had to make the choice.
Right.
Well, let me just ask: did care home operators warn your department right at the start of the pandemic not to discharge hospital patients into care homes without a test? Did they warn you of that?
We didn't have enough tests available to be able to do that without removing tests from other people for whom they were a life-saving matter.
But do you acknowledge you were warned of that?
I don't have recollection of that.
OK, well, the Care Provider Alliance, this is important, they emailed you directly. They didn't email your department, they emailed you directly. And they said all people discharged from hospital to social care settings must be tested before discharge.
But the thing is...
So did you get that email or not?
The thing is that in a situation like a pandemic, right, where you have a limited capacity for testing, and we needed a bigger capacity, and we were building that bigger capacity, you've then got to decide, OK, how do we use these tests?
Yes.
And you've got to, as the politician in that environment, you've got to follow the clinical advice on what use of test is most likely to save lives. And then I'll come back to the social care point, because this is really important. There has been an analysis done of how the virus was most likely to get into care homes. And the proportion of infections that got in from discharges, according to the evidence, is around 2%. Because actually, people who work in care homes live in the community.
Look, I've heard you make that claim before, Matt. Let me just pick you up on it. This is important. Well, I know what you say the facts are.
Well,
do you know? No. I've got it here.
It's the 2021. I say the facts. It's just the published.
Well, no, it's a 2021 Public Health England report, right? That's where it comes from. But that data has been dismissed by care operators because they point out that only some people were being tested. So it's actually impossible to know. Take Vic Rayner, Chief Executive of the National Care Forum, that says the data behind that analysis was fundamentally flawed. And there are others who say that you're actually trying to rewrite an element of history to suit a current narrative.
On the contrary, what I'm trying to do here, and this is really important, and actually...
But how could you know if they weren't tested? You must understand that point.
So, hence, that analysis was done by testing samples and trying to find what the best estimate of the truth, and get to the bottom of what are the facts.
Okay.
And this is one of the reasons I've come on the programme. I think it's really important that we learn these lessons. Number one lesson is have and maintain a big testing capacity, right?
Absolutely.
We didn't have that when I was in the hot seat, but hopefully next time, that will be there and ready. But we've got to get to the evidence-based facts in order to learn the right lessons. Because actually, there's another big...
What happened in care homes was incredibly important, and so
I know, and so I was about to... actually, there's a really big other thing that happened that doesn't get this sort of scrutiny in that space, which is that over the summer of 2020, we put in place a rule to say people shouldn't staff shouldn't move from one care home to another. Actually, that is the thing that is credited by the analysis as making sure that we had much better performance, frankly, in care homes in the
But it was these,
second peak.
and I understand that, and you did make that decision later on. I get that, but so far we've been talking about sending COVID-positive patients coming from hospital. Right?
No,
that's what the discussion is about.
No, that's not true. We're talking about sending people from hospital, and they were sent to be.
But some were COVID-positive and they were not tested.
And they were all isolated. They were all treated as if they might have the disease. So, and actually,
Although you know, care home providers describe the isolation plan as laughable.
I will, and I'll give you this other, case in this argument, which is that the increase in infections that we saw in care homes happened later than after, significantly after, the point at which there were these discharges. So the fact... the point is important, Dan, because because actually what we have to do is learn the right lessons. So what I'm planning to do...
That's what I'm trying to do, because the Department of Health also sent out guidance during the first wave saying COVID-positive residents with symptoms, so this is with symptoms, we're not even talking about asymptomatic people here, could be admitted from a home setting into a care home. Why did you think that was safe?
Because you have to work out, based on the clinical advice, what is the most likely thing to protect lives.
From Italy and you knew from China that the mortality rates in elderly people was incredibly high.
It's incredibly simplistic to make this argument. You have to look at your likelihood...
What's simplistic about it?
Well, I'm about to explain. Your likelihood, for instance, of... there are people who need to go in to get care because their risk of mortality if they stay at home is high. You have to take that into account as well. So we've got to look at all of the different points, and that's what we did look at the time.